The member from London West.
Thank you, Speaker. My question is to the Premier. Jason Miller and Holly Lumley live in London West with their 5-year-old daughter. Shortly after their daughter was born, Jason and Holly were in a serious car accident, leaving them unable to work. Their total family income is just over $2,000 a month, which makes them ineligible for ODSP. But their combined prescription drug costs are approximately $3,500 a month. This means they do not fill most of their prescriptions because they simply cannot afford to. Speaker, why does this Liberal government not care about the high cost of prescription drugs for families like Jason and Holly's?
Thank you, Speaker, and I thank the member opposite for the question, because I think she's making the point exactly why our government has chosen to develop OA Plus. That is why, exactly, Speaker, that our Premier is absolutely has been a champion.
Member from Hamilton Mountain is warned. Carry on.
Speaker, our Premier has been a champion on the national front in urging the federal government and all provinces and territories that we need truly a national farmer care program. But Speaker, we just didn't want to stop there. We wanted to start on that work right here in our province. And Speaker, on this side of the House, we are really proud to introduce OHIP Plus, a first-of-its-kind program that provides free medications, no co-payment, no deductible to all our children and youth till the age of 25. That is 4,400 prescription medication available free.
Answer.
Just by showing your OHIP card. Speaker, that is first-of-its-kind program, and we're expanding that program to include our seniors as well.
Thank you. Supplementary.
Thank you, Speaker. Not only are Jason and Holly going without the prescriptions they need, they are also going without dental care. Since cleanings and checkups must be paid out of pocket, they don't go to the dentist. A couple of years ago, Jason required emergency dental care for infected canines. He had to wait in dire pain in the dental office waiting room while his family and friends scraped together the money so he could pay for his treatment. Speaker, why has this Liberal government done nothing for 15 years to enable families like Jason and Holly to afford the medications and the dental care they need?
Speaker, as I was saying earlier, our government is very much committed to making sure that people have the care they need. That is why, Speaker, our government under our Premier's leadership has been steadfastly focused on strengthening our healthcare system by making investments in our hospital, like the new announcement today of $822 million of new investment. That's a 4.6% increase in base operating funding for our hospitals to allow for more capacity all across the province. The announcement, Speaker, we recently made of investing $2.1 billion over 4 years in mental health and addiction. Speaker, I cannot tell you what kind of impact that kind of well-integrated and coordinated care is going to make in the lives of young people and people of all age background in Ontario who are suffering from mental health or addiction challenges. These are all important steps in making sure that we have got a strong, universal medical health care system.
Thank you. Final supplementary.
Speaker, almost 2.2 million Ontarians go without the medication they are prescribed by their doctor because they can't afford it. 4.5 million Ontarians go without dental care because they can't afford it. Jason and Holly are not alone in their struggle to pay for their family's basic medical and dental needs. Instead of trying to close the gaps in Ontario's healthcare system over the last 15 years, we've seen a Liberal government that has doubled down on Conservative-style cuts and budget freezes, leaving families on their own. Speaker, after 15 years of inaction, does this Liberal government seriously think that Ontarians will believe the promises they are offering now, only 77 days before an election?
Thank you.
Speaker, we're just not making promises. We're actually delivering on these very important commitments, such as OA Plus, Speaker, that came into effect starting January the 1st, that covers free medication for all children and youth till the age of 25. Absolutely for free. It's a first-of-its-kind program, Speaker, in Canada, in fact, in all of North America, Speaker. That is something all members of this House should be very proud of, Speaker. Unlike the New Democratic Party, which put forward a plan, Speaker, that I think barely covers about 120 most popular medications. Speaker, that's not sufficient. That is not universal whatsoever, Speaker. So, Speaker, our program covers all 4,400 medications that are on the list. And as we have said, we're trying to expand that. Speaker, all these things are going to be in the budget, and we hope that the NDP will support such a progressive budget that is for the betterment of the people of Ontario.
Thank you.